Hello, everybody. I'm Dr. Dylan Verden of KIF1A.org, and today I'd like to address something that I think many people have questions about, and that is how current policy related to federal funding of science is impacting KIF1A research. I'd like to start by saying that one of the things that has allowed us to punch above our weight class as a small rare disease organization is that we are a science grounded and science oriented organization. We have a patient community of over 550 individuals. We know there are many more out there due to misdiagnosis or lack of diagnosis, but about 550 people worldwide. And we are supported by a research network of over 150 scientists that, in some way, shape, or form, are studying things that benefit the CAN community. That spans everything from looking at the molecular workings of the KIF1A protein and its many variants, up to the impact of those mutations on neurons, its impact on model organisms like worms and mice, its impact on patient life experience and symptoms, and therapeutic development, because we want to treat individuals affected by CAND. We rely on researchers that rely on federal funding to do the work that they do that benefits our community. That cannot be overstated. What is currently happening is a gutting of the institutions that allow KIF1A research to thrive in the United States. That is coming through the National Science Foundation, the NSF, the National Institutes of Health, NIH, and the Food and Drug Administration, FDA. I'll give a couple examples. In some of the most recent guidance for the National Science Foundation, there were a list of terms that were used as flags for proposed research projects. In other words, these words were used to filter out projects that had been proposed and look at them to see whether they should be disqualified from funding approval. There were a lot of troubling words on that list, but the closest to home for our community, our patients, our superheroes, disability. Disability was a potentially disqualifying term for research projects funded through the National Science Foundation. The NSF is meant to support basic research, but I think that that's something of a misnomer. And I think it's worth clearing up that science is not isolated in that way. The work that we do to understand the molecular underpinnings of KIF1A feeds into our knowledge of how it impacts neurons, feeds into our knowledge of how it impacts patients, and feeds into our therapeutic development strategy. Something I have learned at every stage of my scientific training, my science communication training, my science policy training. Science is not siloed. So using those terms to essentially cut out people with disability from being represented and championed by these projects is a massive disservice. More recently, there have also been attempts to gut funding at the NIH through a massive reduction in what are called indirect costs. And just coming from the common sense language, I think it's very easy to assume that these indirect costs are not going to research projects, that it isn't somehow wasteful. But I would like to show you a figure that breaks down some of the ways that indirect costs very directly support science. indirect costs pay for the infrastructure at institutions that are utilized by research labs across the institution. Core facilities that have expertise and equipment for RNA sequencing or biostatistics or microscopy represent a huge savings because not every project relies solely on those technologies and expertise, but are crucial for moving forward good science. It saves money, it saves time wasted on optimizing experiments, and it is something that is used by many, many labs in an institution. When scientists apply for funding, they often list these core facilities and this equipment as a reason for why they should be funded. It's part of what they are proposing when they are applying for direct grant funding. Equipment maintenance for things like -80 freezers and microscopes and all of the complex technology that is needed in order to move science forward. Administrators who negotiate grant contracts, help with regulatory and safety compliance, save researchers from the opportunity cost that would take them away from doing their actual projects. This, again, is an efficiency that allows researchers to do research. This is just a snapshot, but I hope it shows that these indirect costs are actually very directly related to the work being done. For those of you who don't understand the cadence of research, reductions in funding, pauses in funding, the uncertainty that comes from testing the waters ripples out because these institutions need to make decisions about staffing and project initiation and continued projects well in advance of its actual execution. So every pause, stop, and stutter adds to that uncertainty, and that means that projects get cut. It means that trainees that are the engine of academic research don't get brought on. It means that labs can't staff up. With these indirect costs, it means that many of the underlying infrastructure gets cut out. And that means less science being done. That means that expertise that has been selflessly dedicated to helping children and adults affected by KIF1A Associated Neurological Disorder, not to mention the other 7 to 10,000 rare diseases that we know of out there. Taking that expertise away, taking that support away from these projects is not efficient and it's not moral. It is a massive blow to the work that we have been doing since this organization was founded. It is, even if it's not directly aimed at our children, putting them in the firing range. It is making the world less safe. It is making prospects for improving their lives that much further from reality. We cannot afford for research to be hampered in this way. We need to advocate for the US to remain a vanguard for frankly sci-fi level types of medicine and research. People in our research network are working on incredible things. Screening for anti-epilepsy compounds by testing them in cells derived from real canned patients. Gene editing therapies that would go in and change severe KIF1A mutations back to the healthy copy and hopefully do so for a lifetime. New therapies that come from the forefront of research and repurposing from other disease areas so that we can improve lives symptom by symptom. I'll say it again. We rely on researchers who rely on federal funding to do the work that will someday result in improved lives for our children. I'm so sorry to anybody who is affected by these changes, these attempts. Things are moving very quickly. There is a lot of back and forth as these executive orders or decisions are made, and there's pushback from judges, and then there's a question of whether those judges' orders will be complied with. Things are always shifting. It might be that in a week, some of this is already out of date. Please know that we are keeping an eye on the situation. We are trying to find ways to coordinate advocacy to show that we support and demand support for scientists doing science on the behalf of our community. In the meantime, please contact your representatives. Tell them that you and your family and other people affected by CAND across 46 states in the United States, 50 countries, deserve to be represented and championed by researchers doing science at all levels. Let them know that whatever comes down the pipeline, it is crucial that we continue to advocate and support federal funding for science. Please. So many in our communities and others cannot stand, literally. So for those who cannot stand, please stand up, raise your voice, join us. More to come soon. Thank you.